Hi, I'm Cody. I'm here from Olympia, Washington. I'm 67 years old and in February discovered a large lump in my right breast, which was subsequently diagnosed by mammogram and ultrasound and then a biopsy, which found some cancer in both the breast and the one lymph node. And so I was just leaving on a trip at that point. I had seen a surgeon and she said it would be all right to be gone for 3 weeks and then come back. And I did that, but I still wasn't ready to have surgery. There had been a lot of cancer in my mother's side of the family, and I'd read a lot about both regular and alternative therapies, and I knew that I did not want to do chemo and radiation, but the doctors, the oncologists, were telling me I should do both, as well as the surgery. Couldn't quite make that decision. So I started on the Gerson therapy. I went to a clinic in Southern California and did that for 10 days and then went home and worked on it. But it was a very intensive therapy and it was almost impossible to follow. It was like running a marathon. So the tumors continued growing. It started out when I found it, it might have been the size of a golf ball, possibly. And that was late February, March, April, May, June, and in June it was probably double that size. So that therapy was not working for me, or at least not quickly enough. So I decided I needed something more. I reviewed a movie I'd seen a year or so earlier called Healing Cancer from Inside Out and thought, why don't I see some of these doctors on this film? Started looking into that and chose to come to An Oasis of Healing in Mesa, Arizona, where I could get insulin potentiation chemotherapy along with dietary change, and it was a very comprehensive program that included a lot of information, a lot of detoxification to get all the things out of your body that can help cause cancer or continue it. And it also included many other therapies, and I felt like that was important. So I didn't just want to go someplace and have the IPT and that was it. And I could have done that even at home, although it would have been maybe a little difficult to do that. So I came here and I've been here this is my 7th week. I'm going home in a couple of days, feeling very well. Had a few times when I've been kind of low in energy, just simply finding that I was a little bit dehydrated and low in electrolytes, and by bringing those things to my attention I was able to keep them in better shape. So I felt pretty good most of the whole time I've been here, and that's partly because I haven't had any other therapies. I didn't do chemo at home, I didn't do radiation or surgery. So my experience here has been that it's been very professional, clean, nice. Staff has all been very helpful and informative and professional. The nurses work real hard. They watch you very closely. They make sure your blood sugar is where it needs to be before they give you the chemo. And they watch closely to make sure it comes back up to where it needs to be afterwards. Everybody has done, I think, a really good job, and they've been friendly. Both the staff and the other patients really get to be your friends. So you know that you're going to want to keep up with them when you go home. I've enjoyed my time here, and I feel like the whole thing has been a positive experience, that I will go home. If I can't have a PET scan for another 2 weeks, but I feel like when I do the changes that I felt from the beginning, which I didn't mention, but I've had from after the second dose of IPT, I could feel the tumor starting to change in shape, flatten out, soften up, and become lumpy. And it has grown smaller, and this continues growing smaller. So there's still something there, but it can very well be scar tissue that takes a while to resolve, or just kind of dead cells that are no longer active. We'll find that out soon. And I feel very confident that I've got a handle on this and that I know how to continue once I get home and to follow up with local practitioners that can give me the services I need. So I'm very happy that I came.